Hi, I'm in a tank top today to show you the vagal tone check. I use the vagal tone check as a way to roughly figure how much systemic inflammation is going on within the vagus nerve. It has several components, which I'll break down right now, and then at the end I'll put them all together and show you what the vagal tone check looks like in its entirety. So, first part, head straight. You can be lying down, sitting, later on standing, but at first it's easiest if you're lying down. So lying down, head straight. The next thing that's important is that we find a spot around our diaphragm and what's called the xiphoid process. So here's the sternum, and then here's the rib cage, and then the diaphragm is the bellows for the lung. As you inhale, the diaphragm goes down. So what we're looking for is tender spot along the edge of the diaphragm or somewhere in this triangle. So the bottom of this triangle is the diaphragm edge, and then the one side of the ribs going up, the other side of the ribs coming up. So in through here, we're looking for a tender spot. Now, we don't want to be pressing too hard. It's a tender area, and there's absolutely no need to be pressing hard at all on it. What we want to do is just identify that area, and once we find the spot, that's going to be where we're going to be lightly tapping. Again, lightly tapping. This is just sending a signal. We don't have to yell at the vagus. So, head straight. We have our eyes, both eyes, over to one side. We can do left or right, but we pick one side. Head straight, eyes to one side. We put our hand where that spot was that we found the tenderness, because we're going to be tapping. So, we're going to combine this with the breath. So on the inhale, you start the tapping, and you're going to be tapping all the way through. And on the exhale, though, you'll be humming. It doesn't matter whether you hum in a low tone, medium tone, or a high tone. It's just the humming on the exhale. So you're tapping on the inhale, you're tapping on the exhale, but on the exhale, you're adding humming. So again, head straight, eyes to one side, have that tender spotting through there. You start tapping on the inhale. On the exhale, you start humming, and you wait for an autonomic response. So in the beginning, it's going to take a little bit. It may be a minute. It may even be 2 minutes between you sending this signal and, that number of breath cycles of breathing in, tapping, breathing out, humming while tapping. So you're tapping, you're humming, inhale, exhale, waiting for that autonomic response. A yawn, a tickle, saliva starting to be produced, some kind of signal back. What we're looking for is the relative change in the vagal tone response time. How I use this with treatments is pre-treatment and post-treatment to give an idea of how effective the treatment was and where I might need to do adjustments. And it's also bookends the meditation, the Nova meditation, which is in another video. And it's used there in that meditation to give us, again, an idea of how effective the meditation was. So the faster the response time, the less the inflammation in the vagus nerve. Again, this is roughly, and some medical people are going to be like, but it's not exactly accurate. It's a really good, gives you a good ballpark figure of how much general inflammation is there. Granted, there are some other components involved in the response time as well. Doesn't matter. I will now put this all together. So your head is straight, eyes to one side. Take a nice deep breath in, you start tapping. That's where you start timing it. So what you're looking for again, and then on your exhale, inhale in, exhale, and there. So waiting for that, for me, that was just a salivary response. Usually it's a yawn for me. A friend of mine gets a tickle in his left leg. I don't know why, but some kind of autonomic response. Sometimes also, I should say, I've had patients who get tickles around their nose too. But basically, autonomic response, that's when we stop the timer. So it's that time between starting the tapping and stopping the tapping that we're looking for. Keep track of that, and that will give you a gauge, generally, how are you doing on your health journey. So I hope this helped. Leave some comments below. Give me a call, email, text, DM if you have any questions. Thanks very much and have a good day.